Welcome back to Medical English Pro. Today's topic is something every healthcare professional needs to master: symptoms. By the end of this video, you'll know how to describe symptoms clearly and naturally in English, understand what patients really mean, and use professional, exam-ready vocabulary for real medical contexts. Let's start. Section 1. Symptoms and signs. A symptom is what the patient feels, something subjective. A sign is what a healthcare professional observes or measures, something objective. For example, headache, nausea, dizziness, fatigue are symptoms, and fever, rash, swelling, high blood pressure are signs. So remember, symptoms are felt, signs are seen. Section 2. Types of symptoms. Symptoms can be grouped into different categories. Let's look at some common ones. Number 1. Pain-related symptoms. Dull pain, mild, persistent. It's a dull ache in my back. Sharp pain, sudden, intense. A sharp pain in my knee. Throbbing, pulsing, rhythmic. A throbbing headache. It's a short review of pain-related symptoms. If you want to go deeper into describing types of pain and ways to talk about it, we already have a dedicated video on that topic. You'll find the link right here or in the description below. Number 2. General body symptoms. General symptoms are those that affect the body as a whole, not one specific area. Fatigue. I've been feeling exhausted for days. Weakness. My legs feel weak after walking. Dizziness or lightheadedness. I feel dizzy when I stand up quickly. Fever. I've been running a temperature since yesterday. Chills or shivers. I keep getting chills even with a blanket. Loss of appetite. I haven't been hungry lately. Weight loss. I've lost about 5 kilos in the past month. Sweating. I've been sweating a lot, especially at night. Insomnia. I can't sleep at all these days. Malaise. I just feel generally unwell. Dehydration. My mouth feels dry all the time. Swelling. My ankles are swollen by evening. These are often the first clues that something's wrong, and they help you start building a clinical picture. Number 3. System-specific symptoms. Now let's look at how symptoms differ depending on the system affected. Respiratory. Cough, shortness of breath, wheezing, sputum, chest tightness. Cardiac, chest pain, palpitations, breathlessness, fainting. Gastrointestinal, nausea, vomiting, diarrhea, bloating, abdominal cramps. Neurological, headache, dizziness, numbness, tingling, blurred vision. Urinary, burning on urination, increased frequency, blood in urine. Musculoskeletal, joint pain, stiffness, muscle weakness. Section 3. How to ask about symptoms. Asking about symptoms is a skill, and empathy is key. The classic Socrates approach for pain, already explained in this video, can be adapted to other symptoms. Let's look at some examples of doctor's questions. Can you describe what you're feeling? When did the symptoms begin? Are they constant or do they come and go? Have you had this problem before? What makes it better or worse? Do you have any other symptoms? Notice that each question is short, clear, and focuses on one detail at a time. Patients' responses can be, "It comes and goes." "It's worse at night." "It's getting better." "It started suddenly." "It's worse after eating." It's mild in the morning, but worse in the evening. These are natural patterns of speech you'll hear and use in clinical English. Section 4. Common patient language. Lay versus medical terms. Patients often describe their symptoms in simple, everyday words. As a clinician, you must understand and translate them into medical terms. Patient says, "I feel sick," meaning nausea or vomiting. "I can't stop coughing," means persistent cough. "My legs feel swollen," means edema. "I feel sick to my stomach," means that the patient is nauseous. "My heart's pounding fast," speaks of palpitations. "I'm burning up," fever or pyrexia. "I've got the shakes," tremors. "I've got the flu," influenza-like illness. "I feel dizzy or lightheaded," vertigo or postural hypotension. "My stomach's upset," indigestion or dyspepsia. "I've got pins and needles," paresthesia. "I feel bloated," abdominal distension. "I keep going to the toilet," increased frequency or polyuria. "It hurts when I pee," dysuria. "My joints ache," arthralgia. "My nose is blocked," nasal congestion. "I've got a lump," swelling. "I feel weak all over," fatigue. Learning both versions, patient and medical, makes you fluent in both worlds of communication. Section 5. Interactive practice. Time to test what you've learned. Ready? Exercise 1. Identify the symptom type. I'll read a few sentences. You decide what kind of symptom it is.
I've been sweating a lot at night. Answer. General symptom. Night sweats. There's a burning feeling when I urinate. Answer. Urinary symptom. Dysuria. I feel dizzy when I turn my head. Answer. Neurological symptom. Vertigo. My joints ache, especially in the morning. Answer. Musculoskeletal symptom. Arthralgia.
Exercise 2. Translate the patient's phrase. Match the patient's phrase to the medical term. "I can't stop coughing." "My legs feel swollen." "I feel sick to my stomach." "My heart's pounding fast." So, patient says, "I can't stop coughing," meaning persistent cough. "My legs feel swollen," means edema. "I feel sick to my stomach," means that the patient is nauseous. "My heart's pounding fast," speaks of palpitations. Exercise 3. Mini role play. Now it's your turn. Pretend you're the doctor. Patient says, "I feel very weak and I've lost my appetite." What questions will you ask? Write your version below and I'll check your answers in the comments. Well done. You've learned how to describe and understand symptoms, from everyday language to precise medical terms. Don't forget to like, subscribe, and turn on notifications for more Medical English Pro lessons. See you in the next class, and keep speaking medicine with confidence.